More and more people are using experimental research compounds in an attempt to improve various aspects of their lives. One category of these research chemicals are the SARMs. This stands for Selective Androgen Receptor Modulators. In order to understand what SARMs do, it's important to first get an understanding of steroids and their evolution into SARMs research. The original hormonal support involved taking synthetic testosterone in an attempt to delay the effects of aging, increasing muscle mass, decreasing body fat, improving sex drive, motivation, and masculine traits. A basic understanding of how testosterone works involves its anabolic to androgenic ratio. Testosterone has an anabolic to androgenic ratio of 1:1. This means 50% of the compound exerts an anabolic effect on the body, and the other 50% of the compound exerts an androgenic effect on the body. In simple terms, this means the anabolic portion increases muscle growth, fat loss, strength, and well-being. The problem is the androgenic portion, which can cause the most common side effects from overuse, misuse, and abuse, such as hair loss in men and hair growth in women, deepening of voice, mood changes, temporary loss of periods in women, testicular atrophy, and temporary or permanent sterilization in men. This anabolic rating of 1:1 for testosterone is used as a basic measurement to assess the potential of steroids and SARMs. The term anabolic gets misused and associated with only steroids. The truth is, the body is always either in an anabolic or a catabolic state. An anabolic state could be when you have sufficient protein and you're exercising enough without over-exercising, and your body is then converting your calories, mainly the protein, into muscle growth. A catabolic state, for example, could be when you're over-exercising, not eating sufficient calories to maintain your growth, and your body starts breaking down your muscle stores and converting them into the calories that it needs for survival. Extreme bodybuilding, marathon training, and other forms of overexertion can put massive calorific demands on the body. It's not unheard of for bodybuilders, professional athletes, and ultra-marathon runners to need to consume up to 10,000 calories per day to maintain their size, strength, and their muscle mass. Muscle burns more calories than fat. Therefore, the more trained an athlete becomes, the more calories they need to maintain their anabolic state. One reason that many people don't want to take steroids is mainly they need to be injected, and this is seen as unnatural and dangerous. As testosterone has an anabolic ratio of 1:1, steroids like nandrolone can have a ratio of 10:1, meaning they're 10 times more anabolic than androgenic. This means they can give greater muscle building and fitness improving potential when compared to testosterone, with the reduced risk of androgenic side effects associated with them. The next leap in the science of sport and fitness comes with SARMs, which are designed to selectively bind to the androgen receptor sites in the muscles rather than the androgenic sites, for example, the hair follicles and the testicles. SARMs anabolic ratios can go up to 90:1, implying a much greater effect by means of a lesser dose needed, reducing the potential toxicity of high-dose compounds and also the potential to use these drugs in women who would be the most susceptible to the side effects of steroids. One reason people use SARMs or steroids is their ability to maintain the anabolic state without requiring as much protein in their diet, as the SARMs and steroids can help with nitrogen retention in the muscles that would normally be achieved only through a high protein diet. There's numerous SARMs available, such as ostarine, LGD-4033, LGD-3033, RAD140, ACP-105, and S4, and pseudo-SARMs S23 and YK11, which are much stronger and, as a result, potentially more suppressive. I'd need to make more videos comparing these as there's lots of information available. The most published studies and the compound recommended for beginners, both male and female, is ostarine. Interestingly, when various chemotherapeutic medicine was tested, it was found that by mixing various drugs, lesser doses were needed when in combination in order to achieve the same and even greater benefits, with the reduced side effects over a large dose of one chemical. This synergistic effect has also been noted with various other drugs such as nootropics, etc. Therefore, an interesting field of study would be on the synergistic effect of the variety of low-dose SARMs when combined. It's important to remember that many SARMs were not designed as steroid replacements, but they were intended for other medical uses, such as preventing wasting in the elderly, in AIDS patients, and improving bone density. Testosterone activates the subcortical areas of the brain to produce aggression, while cortisol and serotonin act antagonistically with testosterone to reduce its effects. A small amount of testosterone-related aggression may lead to more motivation, risk-taking, and a desire to exercise harder and to succeed. However, too much aggression may have many negative impacts on one's life. RAD140, YK11, and S23 have all been noted to be able to increase aggression in a dose-dependent manner. Despite the many benefits that people claim to get from SARMs, as they're so new, it's possible that they have the same sorts of side effects as anabolic steroids, such as the potential for liver damage, kidney damage, testosterone suppression, mood changes, and cholesterol. For this reason, anyone who's experimenting with these substances is highly advised to have regular blood tests both before and after a cycle in order to assess their impact on the body. Like everything, different people respond differently to different compounds for a number of unknown and known reasons. For example, they may alter one person's cholesterol levels, where they may alter another person's liver function scores, or they may suppress testosterone in another person. One main way to reduce side effects is with cycling. Paracelsus expressed the classic toxicology maxim: all things are poison, and nothing is without poison. The dose alone makes it so a thing is a poison or not. This means to take a substance, for example, for 8 weeks, then take a 4-week break where herbal and supplemental detox products are used for helping liver function. Heart support is used for cholesterol benefits, and testosterone support to ensure that normal functioning is quickly restored. Not only is the time on, time off cycle length important, also the dose used for the time is important. One big problem with professional bodybuilders using and abusing substances is they have a body image disorder and they're never happy with the results and they want to get bigger and bigger. As a result, they don't take any time off their steroids or their SARMs, and instead they keep increasing the dose as their body builds up a tolerance. This then results in no extra muscle gains, but a much greater chance of all of the accompanying side effects. As each compound and each dose of each compound technically requires a different cycle dose and length for optimal results, and this dose and cycle length is also dependent on the individual's reaction to the substance. It could take years of trial and error, starting with a small dose and a small cycle length, accompanied with regular blood testing in order to determine the ideal cycle length and the dose of a substance for an individual. Again, if a person is already on testosterone replacement therapy, or TRT, then they're capable of running longer cycles at higher doses without needing to worry as much about testosterone suppression, as they're already receiving a base testosterone dose to maintain their normal functioning. Another myth is how people think that by taking anabolic steroids or SARMs, they'll grow muscle and lose fat. However, like taking smart drugs won't improve cognitive function unless one is studying or taxing their mind, and all the diet pills in the world won't work without exercise and calorie control, so too the anabolics won't work without diet and exercise being optimized first. Some more experienced trainers would suggest that you train, for example at weightlifting, for 3 years. Then, in that time, you should have enough of your basics optimized, such as your diet, exercise, and techniques, that you've reached your natural potential, and only then, at this point, anabolics can be added to take you past your natural, inbuilt genetic potential, allowing you to make extra muscle gains. One of the main benefits of SARMs and anabolics is their ability to speed up muscle healing. It makes it a lot easier to train each day if you've recovered and you're not sore from the day before. In order to try to build more muscle, bodybuilders took anti-inflammatory drugs to allow them to be able to continue training each day. The results, however, were not what they expected. Although they were able to continue exercising each day without pain, without the inflammation present to stimulate the muscle growth, they didn't grow any more muscles. Anabolics, on the other hand, speed up the muscle recovery while still encouraging the muscles to grow. Many believe this enhanced muscle recovery is evidence of the healing and life extension potential of the SARMs and anabolics. You can look out for future videos where I discuss some of the clinical trial results of the various SARMs on animals and humans. Make sure to check out my follow-up video on herbs and other methods for post-cycle therapy and an on-cycle support, which can help to maximize the benefits and reduce the side effects of anabolics. And check out my video on DMSO to see how it may be able to increase the potency and the absorption of compounds like SARMs, increasing their effect, while also reducing their side effects. And remember, these chemicals are for research purposes only. As they are new, they may contain unknown risks, so this is not an endorsement to take any of these. They're not meant for human consumption. Always discuss any medications or supplements with your medical doctor prior to taking them.